Hello everyone, so today I'm going to be doing my postpartum assessment. Didn't have anyone to do it on, so I'm going to be doing it on a baby again. But just pretend it's a mom. So before coming into the patient's room, I want to make sure that I check to see if the mom is breastfeeding or bottle feeding, whether she had a C-section or a vaginal birth, and a little bit of the mom's history, whether she has history of depression or if she does not, or things of that nature, or wishes for the mom. So once I've done that, I'll come knock on the door, wash my hands, provide privacy, introduce myself. Hi, I'm Priscilla Campos. I'm a nursing student. Is it okay if I do a postpartum assessment on you? Hopefully the mom will say yes. And then I'll get right into it. And so you want to start by assessing her breast. This mom's going to be bottle fed, so I'm not going to be like touching her nipples or her breast at all, because you don't want to stimulate any milk production, and by touching it, you're going to be stimulating milk production. I just talk to the mom, be like, hi, so I'm just going to pull down her shirt a little bit just to make sure that she doesn't have any engorgement, and I'm not going to touch them. We just want to check for any engorgement or mastitis, which hopefully you won't see mastitis at this time. And then I just want to kind of ask mom, if she's having any pain or anything in her breast. No, I'm not. Okay. So I just asked mom, like, how's bottle feeding going? And she's saying that's going good. So perfect. So you just want to make sure that you encourage mom to so this mom is currently not wearing a bra, so you would just encourage mom, hey, if you could wear like when you wear, it's good to wear a bra to make sure that you hold your breast closer to your chest. So like a tighter bra, like a sports bra, or like a compression top, so where your boobs are, your breasts are more supported. And when you get into the shower, you can wash, you can wash your breasts, but don't stimulate them too much by like cleaning them too much, or like letting water hit them a lot, because it will stimulate them. And then you tell the partner as well, because if you're bottle feeding, you don't want to be stimulating your breast to create milk production. So once we've crossed that path, hopefully mom wouldn't have had any trauma to her breast or anything of that sort, but if she does, you would want to note that, which this mom does not, in fact. So then you're just going to pull this up. Hey, mom, you're just going to pull this up and just going to check your uterus. And then so you'll put one hand here at the perineum and then one hand above the umbilicus, and you'll just kind of push down, and it should feel firm, which this mom's does feel firm. And if it were to feel boggy, I would leave my hand there and massage it and stuff until I could find the uterus. And if I can't, then I need to call for help. And then you want to do bowel and bladder. So, hey mom, have you voided today? Have you got up to go pee? Yes, I did. Okay, great. When you went to pee, did you feel like you were able to empty your bladder fully? Yes, I was able to. Okay, perfect. Have you been able to have a bowel movement today? Yes, I have. It was a bit painful, but I was able to have a bowel movement. So then you would want to tell the doctor, but you could give the mom stool softener, and that will help the mom. And then I'm just gonna pull this back up, and then I will check for any for any rubra, serosa, or alba, but right now she's in the stage of rubra. So I would just check for how much discharge was on the pad, which wasn't incredible. So you just want to document that, and that she's at the stage of rubra. And while I'm assessing the loci, that's what it is, the lochia. And while you're assessing that, you could also be assessing for any redness or lacerations, edema, or oh my goodness, there's a word for it. redness, edema, drainage or approximation, or ecchymosis. So I don't know any redness. So this mom also had a vaginal birth. If she didn't have a vaginal birth, you would just check the cesarean C-section scar, and you would just assess that. But this mom had a baby vaginally, so I don't know any redness. A couple of, lacerations, trauma to the canal. From when giving birth, she tore a little. And then I don't know any ecchymosis or as far as drainage goes, I just note the loci, which is rubra, but no abnormal drainage. And it is stitched well. No problems with approximation. Pull that down. And then you want to check the mom for, her legs. Like, hey, mom, have you been up and walking? Yeah, I walked to the bathroom. So you just want to feel the legs for any heat. And ask her if she's having any pain in her legs. Having any pain in your legs? No? Okay. So you just want to make sure that she's not having any blood clots. And encourage her to walk. And then you would want to ask mom about her emotional well-being. Like, hey, mom, how are you feeling? Yeah, I'm feeling pretty good. That's good. Have you been able to hold the baby? Yeah, not as much as I would like to, but I would like to hold the baby more. So, okay, perfect. So you would hand mom the baby, encourage bonding with the baby, make sure she's not having any postpartum blues, or you don't notice any signs of distress that could lead to postpartum depression. So you would hand her the baby, talk to her about how bottles feeding is going, which she told us in the beginning that it's going good. If she's having any questions or anything that she's uncertain on, you want to make sure to let the provider know, and make sure that she knows that she has people that she could talk to. But yeah, and then make sure that she's not bleeding or anything like that, besides the lochia, but no any abnormalities. But mom seems to be doing well. And then so I would just hand the baby to mom, ask her if she needs anything else. Do you need anything else? Would you like to get up to go to the restroom or anything? No, I'm okay, thank you. Perfect. So I just wash my hands, and then I'll go chart.